Thank you for your time today and your interest in promoting physical activity in the children of Mercer County. This presentation will introduce you to Pedal Life, a proposed Learn to Ride health intervention for 3rd through 5th grade students. John F. Kennedy once said, "Nothing compares to the simple pleasure of riding a bike." This is a school-based intervention with a community involvement component after the initial first 6 weeks. Program planners seek to increase physical activity in the students involved by 30 minutes per day, increase their knowledge of healthy nutrition, and provide bike safety training. There is an urgent need in the United States, and especially in West Virginia, for health intervention programs due to the growing obesity problem and obesity-associated health conditions. According to County Health Rankings and Roadmaps 2019 data, adult obesity in Mercer County is at 38% of adults. This is the adults who reported their BMI. So in reality, the percentage is probably much higher. The most recent numbers on childhood obesity from the U.S. Department of Health and Human Services October 2017 data brief puts U.S. childhood obesity at 18.5%. With adult obesity in Mercer County in excess of 10% above the national average, it stands to reason that childhood obesity levels in the state are also above the national average. This obesity crisis is why an intervention like Pedal Life is so important to the future of our county, state, and nation. If the coming generations do not realize the importance of being physically active and healthy, the medical costs alone will destroy the economy of our nation. According to an article in Preventative Medicine, childhood participation in sports is shown to have a greater effect on adult physical activity than undirected outdoor play. Structured activity like group cycling is the type of activity that will lead to a greater level of physical activity as an adult. This article also states that physical activity tracks from a childhood to adulthood, meaning an intervention like Pedal Life would have long-lasting effects for the children involved. This program will begin 6 weeks before the end of the spring school term. Program staff seek to incorporate 20-minute yoga sessions, bike safety lessons, and nutrition training into existing physical education classes. Of course, in order to incorporate this program, a partnership with the Board of Education will be required. The BOE will have to approve the program, allow program staff access to the schools, and agree to provide first aid staff during school hours. Program staff for the in-school portion of the intervention will be a certified yoga instructor, bike safety instructor, and a certified dietitian. Program staff will seek to make necessary adjustments in order to prevent disruption to any academic requirements currently in place. A release of liability form will be required for all students participating in the program. An example of the form is included in your handout packet. Yoga. Why yoga classes for a biking intervention? Because the purpose of this intervention is to motivate children who do not get enough physical activity to participate. Beginning the intervention with yoga does not require that the children have any special skills or equipment. Building on the social cognitive theory construct of self-efficacy, when the children complete the yoga classes, it will provide them with a sense of accomplishment and confidence in their abilities. Research has shown that yoga reduces stress in school-aged children and may provide a means for them to deal with and control emotions through the breathing techniques taught in yoga. Combating anxiety when learning to ride a bicycle will assist the child in learning this new skill. Yoga also develops kinesthetic awareness, which is especially important in the sport of cycling. Controlling your body position and balance on the bike will prevent injuries to the rider and those riding with them. Due to the many muscles that are engaged during cycling, yoga is beneficial to stretching those tight muscles and bringing the body back into balance. Understanding healthy nutrition is important in any health intervention, and classes will receive lessons in nutrition from a certified dietitian. Students will learn about choosing the right types of foods in the correct portion sizes in relation to a healthy diet. Program planners understand that children have very little control over the preparation of the meals they consume. It is the hope that offering children information to make better choices, they will choose the better option when offered. Introducing fruits and vegetables they may not be served on a regular basis will also increase their exposure to healthier options. They will also learn how different types of foods affect the energy available for their rides, as opposed to consuming energy bars and drinks full of sugar that are being falsely advertised as healthy. Just because America's milk companies recommend drinking chocolate milk as a recovery drink doesn't mean it's a good idea, especially when 8 ounces of chocolate milk contains 24 grams of sugar. The American Heart Association recommends kids 2 to 18 have less than 25 grams of sugar a day. It is not likely that any child needs 24 grams of sugar to recover from exercise. Classes will receive bike safety lessons from program staff using information from the National Highway Transportation Safety Association and Shape America's Bikeology program. Bikeology is a bike safety program developed through grant funds from the NHTSA. So, information will be consistent between both programs. Bikeology was developed for grades 6 through 12, so it will require modification to accommodate the younger students who are the target population of this intervention. Program planners want the children in this intervention to fall in love with the sport of cycling and to continue to enjoy it for years to come. That is why bike safety will be a large portion of this intervention. It is a necessity that children understand the proper bike safety and etiquette. The program will incorporate an after-school component with learn-to-ride sessions for 10 children each in 3 45-minute group sessions each day, Monday through Thursday, until 6 p.m. for the 6 weeks of the in-school part of the intervention. The children will need their own bike for this portion of the intervention. However, if a child wishes to participate and does not have a bike, the program staff will be working with vendors to provide discounts for purchase, or hopefully grant funds can be secured to provide free bicycles for those students. A free certified bike helmet will be provided for all children participating in this portion of the intervention. 10 program volunteers will work one-on-one with students to learn to ride or improve their riding skills. Learning how to ride a bike is a classic rite of passage and a skill that once acquired is never forgotten, according to the REI Co-op website. It is also during this portion of the initial 6 weeks that students will be classified according to their skill level for those who choose to continue in the summer component of the program. At the end of the school year, 30 children interested in continuing the program can transition to a 6-week summer day camp. Enrollment will have to be limited due to the cost constraints for the first year, but program planners are hopeful that the success of the program will lead to additional sponsorship and more children can be served in the future. During the summer camp, students will continue to practice yoga, learn bike safety rules, and cycling nutrition training. In addition, bike skills and repair will be taught. And every Friday, there will be group rides on local trails. Having the rides on local trails will introduce the students to places for riding options after the program ends. One contributing factor to the obesity problem in Mercer County is due to the rural nature of our area. Lack of sidewalks and safe areas for riding and walking contribute to the lack of physical activity of our residents. According to county rankings and roadmaps, 30% of Mercer County children are living in poverty. Due to this factor, it is the desire of program planners to provide this intervention at no cost. In order to offer this as a free program, program staff will need to develop partnerships with several local organizations and businesses, and possible collaboration with the West Virginia Action for Healthy Kids state team and Princeton Community Hospital are being researched. On the last Friday of the summer day camp, there will be a picnic following an all-day Rails to Trail ride with all campers, staff, and volunteers. Parents will be invited to ride along or to attend only the picnic. At the picnic, there will be games and camp awards. However, the ultimate award will be those participants who fall in love with the sport of cycling. Colin Henrys of Road Cycling UK says that there's little that can beat the beautiful simplicity of a bike ride. As with every great idea, everyone is on board until someone mentions the budget. The budget may be difficult to see here on the screen, but a physical copy has been provided in your handout packet. Many of the staff assisting with the after-school and the summer day camp will be unpaid volunteers. The cycling community is always anxious to encourage the interest of young people to the sport of cycling. There are many cyclists in our immediate area who are very anxious to see new riders coming up and are willing to help them. The members of the Athens Bike Trail are also willing to help with cycling programs, and we are actively seeking collaboration with the Mercer County Adventure Trails program. According to the Business Journal's BizWoman June edition, less and less children are riding bikes. Several factors are contributing to this trend. Electronics is the #1 culprit, stealing our children from outside activities. Busy extracurricular activity schedules are also leaving little time for outside play. And unsafe neighborhoods are causing parents to keep children inside instead of allowing them time on their own. All these factors are preventing children from learning to ride bikes and other outdoor exercise, and contributing to the childhood obesity epidemic. Even with volunteers, this is a significant budget, and as mentioned previously, the program planners will have to establish partnerships in the community, not only for support and access, but also for funding in order to make this intervention a success. As with any preliminary budget, some items may be more expensive than expected, but the only area we see as increasing would be the food expense. Although we plan to keep costs low, we do want to offer healthy food choices, and many times costs are dependent on availability. Each student participating in the school portion of the intervention will be given pre- and post-tests listed above. Bicycle safety rules, bicycle parts, BMI, which will be calculated by a program nurse, choose the healthy food, and self-reported activity minutes. You have a sample of the bike parts and bike safety test in your handout packet. On the bicycle parts test, for example, students of the in-school portion would be expected to know at least the bicycle parts in the red boxes. However, summer camp students would be expected to know all the parts listed by their post-test. The summer day camp participants will take pre- and post-test in bicycle safety, bicycle parts, skills test, BMI, which will also be calculated by a program nurse, and food or fuel. Although students will have just completed the post-test for the rules, parts, and BMI evaluations, program planners feel it is important to have both sets for comparison and reporting purposes. The skills test portion of the summer camp evaluation will be conducted on the bike to see how each student does in actual practice. Summer campers are not questioned about daily physical activity minutes, since participation in the camp would skew these results. The majority of the information collected on these surveys will contain actual knowledge-based evaluation. Because the information is not self-reported, it will remove a great deal of bias and will make it easier for program evaluators to determine the success of the program and where adjustments need to be made. All final evaluation data will be made available to the Board of Education and all other partners of the program. With evaluation data from both parts of the intervention, the initial 6-week in-school program and the 6-week summer camp program, planners will be able to determine the effectiveness of each program on its own. It will also allow for evaluation of both parts of the program together. This way, if the program is repeated, the lasting effects on students can be more readily determined. Those who did only the 6-week in-school intervention and those who did the complete 12-week intervention. These multiple evaluations will provide more support for future replication of the intervention. Once again, thank you for your time. If you have any suggestions or questions, you may contact me at cworley@concord.edu. And remember, in the words of famous cyclist Eddie Merckx, write as much or as little, as long or as short as you feel, but write.